Good remote.
Hey, everybody, and welcome to episode 40 of Truth or Trend, where Dr. Vrzal and I get together every week, talk about some new things that are happening, and give you our perspective and what we think we can do about keeping people as healthy as possible for as long as possible, feeling good as possible for as long as possible. And in that spirit, this week we've been seeing some interesting data on some research that came out recently. We're going to share with you. Our goal is to help people know that there is a lot we can do about this cognitive decline situation coming. So many people realizing that the levels of Parkinson's, Alzheimer's, just dementia in general, are on the rise, and they are set to or predicted to rise rapidly over the next few years. And so, what we were hoping to do today is to point out something that may be a major driver of that, or one of the major drivers of it that's not talked about enough, give you some alternatives to that and help us understand the mechanisms of it. So, without further ado, Dr. V, you're the one who brought me this research. What inspired you to bring this research to me
Rock and
specifically?
roll. Yeah. So, I mean, it really kind of came to me as after working with several people, on a lot of them, but a few, there seemed to be a very common thread with these Parkinson's people that they had had surgery. A lot of them had back surgery and that. So I was thinking, oh, maybe is there a titanium sensitivity or, what's going on here? As I started digging into the research, up pops this, opioid concern. And then
Mm,
it's, aha, ding, light goes on. Okay, opioids are affecting dopamine reception. That's why people get addicted to it. That's why street drugs are all, aimed at affecting dopamine metabolism because when dopamine's high, that's elation. That's, we've talked about that with L-Reuteri and some of the other, products and precursors there. It's a, precursor to sex hormones and sex is fun. It feels good.
right, right.
Right? So, anything that, pharma or street drugs and things can do to facilitate that is popular. People like it, and that's why people get addicted to these. So anyway, that came up as a very common thread for these people with Parkinson's. And
Mm.
some of the one of the papers we're going to show, within 6 months prior, they had a much higher propensity for Parkinson's. So that started to make sense, and I've been asking around with some. I've unfortunately lost a couple of patients that had had Parkinson's, and so I've been asking spouses and things to try to get a handle on how relevant this is for people. It's not certainly not 100%. It's not across the board that hey, they'd had the season of pain and they were on these drugs, but there's some inference there. But certainly we want to lean into the fact of dopamine metabolism because that ultimately is what Parkinson's is all about. Dopamine is the you let off with memory and cognitive decline. Dopamine is the neurotransmitter it's the hard drive for the memory. So if dopamine is low, is not functioning properly, our hard drive is broken, and so we don't store those memories over long term. So that's where the cognitive decline challenge would come from. Then the other part we're going to talk about today is the pain. People are taking this because they had pain, they had a problem, a dysfunction somewhere. But this is really the theme of all 40 podcasts we've done now.
Right, yeah.
The location of pain is everything. I've talked
Mhm.
about my original working title for the headache book was headache location, location, location. Because
Mhm.
again, where does it hurt tells me exactly what organ or what dysfunction is going on in the body. So we're talking Parkinson's. I talked about low back surgeries and so on. That L5, the very lowest vertebra in the back, super common place for people to have pain and take pain medications for and that sort of thing. It's typically an adrenal short circuit, if you will.
Mm.
So that L5
Mm.
goes out when a person's under chronic stress, not handling properly or doing too many stimulants and things to try to get through the day. Then they're going to manifest pain there and then reach for something to handle that,
So I think that's worth
pain.
repeating. So L5, anytime you've got somebody out there who's got issues with their L5, especially pain around their L5, instead
Mhm.
of reaching for maybe Boswellia or some type of anti-inflammatory, you might get better results if you reach for what? Adrenal desiccated, or
Right.
what kind of products do you find are really helpful in that situation?
So in that we're talking hypoadrenal, they've kind of crashed and burned it by that point. So rhodiola ginseng is good for the chronic, the burned out adrenal complex, especially if there's a knee problem or ankle problem that typically, for whatever reason, adrenal complex rises to the top of the first product I'm going to test somebody on.
Mm,
But yeah, adrenal desiccated, Drenamine. The
hmm
nice thing about Drenamine is it has those vasorelaxers, has the B2 in there that helps lower blood pressure and so on. That would also go along with this stressed, obsessed, chronic adrenal fatigue. So those are, yeah, certainly some healthier options to get that low back, that L5 low back pain. We probably ought to do a whole episode on low back pain because there's a
Yeah.
few other triggers certainly there.
Well, I mean, remember, I mean, when I had my injury after running that LA marathon and that I had a bulge disc at L5, and
Hmm.
it was insane. When you muscle tested me, the top thing that came up for me was adrenal support, of course,
Hmm.
and astragalus complex actually is the one, or
Right.
astragalus complex is the one
Hmm.
that was the hot ticket, as you say, for me in
Yeah.
that situation. So it's interesting because there are so many different, adrenal support products, but anything that would support the adrenals would probably be worth investigating at this point before
Right.
for pain.
And so the difference, just to make it clear, because astragalus is huge. Well, astragalus is for the immune aspect. Ashwagandha is the other one that's getting a lot of press right now from an adrenal
Mhm.
perspective. Ashwagandha is more for the more acute, the overzealous cortisol production. That's a different pattern, different constellation. But yeah, astragalus is great for the chronic immune challenges that are adrenally related that
I
would go
may
along
have
with
been a
running a
little,
marathon.
yeah, I was going to say, I may have been a little pushing my adrenals at that point, right, running marathon and all the other
Yep.
things that you and I get to do on a regular basis.
Right, right. Just finished a 4-hour mountain bike race 2 days ago,
Yeah.
right? Same thing.
Yeah, I could hear your adrenals in the video that you showed
That was
crossing
funny,
the
huh?
finish line. Well, let's share a little bit of this research real quick that
Let's
where we're
go.
looking at, just to kind of give
Hmm.
people some more context. So
Yeah.
the Alzheimer's Association in this was May of 2025, so not too long ago, did publish this research article on the regular use of opioids and dementia. And they were showing this with this was a UK biobank participants with a chronic non-cancer pain. And they were showing regular use, opioid use was associated with a 20% higher risk of all cause dementia. That's pretty significant, I would say. 49% higher risk of vascular dementia compared to those not using analgesics. And moreover, those using strong opioids had a 72% higher risk of all cause dementia and a 155% higher risk of
Hmm.
vascular dementia.
And look
So,
at the numbers too. I mean, was that say 197,000 participants? I
yeah,
mean, that's massive, massive population, N of
absolutely.
200,000. That's huge.
Yeah, absolutely. Yeah, which just adds more and more validity and weight to us really,
Totally.
taking a deeper look at this. And this is pretty recent as well. So
Hmm.
yeah, this is going to be something that, of course, we want to be very paying close attention to. Now, some of the other questions that people are going to be asking is like, for how long, right? So here was another research on this that came out. Let's see, when was this one? November of 2024. So about a few months before that, this was a Danish population. Now they were showing, now I think this is helpful. The study found that opioid use less than 90 days was not significantly associated with it, but anything beyond 90 days was associated with an elevated dementia risk before age of 90, which persisted in individuals with chronic non-cancer pain. So maybe short term, right? I wouldn't be insanely worried, but I'd still be concerned, right, of any opioid because, like you
Right.
said, it was after surgery that everybody was having these situations.
Hmm.
Was
Hmm.
let's see, this one is another one from September of 2024, association of regular opioid use with incident dementia, and then long-term opioid use and dementia risk in patients, another PubMed article here that was published. I'm having a hard time finding the dates here. Oh, this was 2023. And then I believe this is the one that you had brought up, right? The incidence of opioid use before and after Parkinson's disease diagnosis. That was the one that
Right.
really caught your attention. And what is it that
Yes.
you wanted us to point out on this one specifically?
Yeah, just the fact that there's definitely a propensity of, and again, massive numbers on this study that of
Right.
the population segment that they used, but just the incidence that using these things compromises again. So the reason we're talking dopamine and dementia in the same podcast is the commonality between both those is dopamine metabolism, right? And so Parkinson's is substantia nigra in the brain not producing proper amounts of dopamine, and then movement disorders ensue. And I just referred to the fact that dopamine is a hard drive for memories. So if we don't have that dopamine, we have a broken hard drive to store. So that's the commonality between these two clinical entities, that we now know. These medic, and this is all super fresh research. This
Yeah.
is cutting edge right now.
So
Um,
let's talk
Go
about
ahead.
dopamine production then. Let's start with that, and then we'll get into dopamine reception, right? Because that's the whole
Right.
picture that we really want to get to. And you were saying
Right.
earlier that a lot of the research is focused on dopamine production, right? Because they're worried about what's happening in the substantia nigra.
Right.
So,
And so some of the worst case scenario for Parkinson's is actually, uh, what do you call it? Implanted device to produce dopamine, right?
right,
So
right.
I mean that's how medicine functions. That if the body's not doing it, put some device, kind of like an insulin pump. It's like a dopamine pump, if you will. That
Mhm.
sounds fun, huh?
Yeah.
Live your life on ecstasy all day,
Well, and my point, whenever it comes to that, is okay. So it's stimulating, right? It's trying to create it, but with what? That's like
Hmm.
bringing a new foreman to the work site, and he's just whipping the workers, but there's no bricks, right?
Yeah.
So, like, how are they supposed to make things work without the actual basic building blocks that they need to make dopamine, right? And that's where I
Utilization.
always bring
Right.
back the conversation immediately to tyrosine being a conditionally essential amino acid, being one of the main reasons that people are struggling with dopamine production. Because number one, they're maybe not eating enough protein, but most
Mhm.
of the time, people are definitely not digesting enough protein. So we have to
Mhm.
go back and we have to address that first, in my opinion, right?
I love it.
We
Yeah.
can't assume that the supplies are making it to the work site. So
Yeah.
who cares what's going on with the work site if we don't have the supplies there to do anything with it?
Hmm.
So definitely, so amino acids, you have to have your tyrosine or
Building blocks.
phenylphosphine, which of course is the precursor. And this is
Okay.
where things like protofood become very, very powerful, very
Mhm.
important. And I can almost no matter what I'm talking about, I can almost always say, well, let's put some protofood in there just to make sure we have the
Mhm.
bricks, right?
Yeah. Yeah.
For
Yeah.
this building. But then you also need, magnesium, zinc, yeah, vitamin
B6.
D's, B6 for sure, right?
Hmm.
They're
Hmm.
common things that are missing from people. So this is where
Very.
something like a Neuroplex becomes a hero product because it has
Hmm.
ample B6. It's got ample zinc, right? Depending on the person, what they're needing for them.
Hmm. Hmm.
And it,
Hmm.
and it often becomes a part of a lot of these cognitive decline protocols for myself, for those two things to start with, for sure.
Right. I mean, zinc is a heavy player in dopamine metabolism, and it's probably the most common deficiency, right? And out there. I mean, those of us that are doing the zinc test, right?
Mhm.
I mean, I used to talk about 199 out of 200
Yeah,
typically would be zinc deficient,
sure.
We got sugar depletes zinc, stress depletes zinc, stimulants deplete zinc, flus, viruses, deplete zinc. So any of that, and then we downregulate the P450, the first phase of detoxification, on and on and on about all the zinc. So if you have white clouds in the fingernails, look for those, listener. Then
Hmm.
that's a sign that you've got pretty acute, pretty significant zinc deficiencies. So that's an easy place to start. Get the pumpkin seeds, get the foods in there that have zinc in them. Is at least a starting point to head off. We don't
Thank
want
you
to
for
go
bringing in my
Parkinson.
beloved pumpkin seeds to the conversation. I often refer to them as one of nature's multivitamins, because
Yeah,
it's
yeah,
got it also has the proteins in it that we were just talking about. Also has the vitamin B that we were talking about
right.
in there, right? So that's a big piece
Easy
of it.
snack.
Okay,
Hmm.
so we got our whole list of all of this construction material that we need, right, to get to the
Right.
construction
So
site,
we got the bricks in the construction site now.
right? So let's talk about the construction site. What's going on there?
Right.
What's happening? Why is it
Right.
substantia nigra the place that we need to support, and what does it need for support
Yeah,
specifically?
it's nutrition. It's don't compromise it with things like, pharmaceuticals that are going to downregulate the way it functions,
Yeah.
which is part of the conversation with, all the opioids that we're talking about.
Yes.
And, taking Parkinson's medications, it's very well known that you get a short-term kick, but the long-term benefits that you need more and more and more of the drugs. It's kind of like
Right.
the dealer man, your first drug, first one's on me.
That's
Mhm.
exactly what, so I had a case over 10 years ago now who came and she had Parkinson's and she, felt better. Her tremors went away after we talked about her, right? We worked on her as a person, not going after Parkinson's. Her first comment to me was after 3 days of no tremors, well, this always happens with a new drug and then it comes back, right? And she's done so
Mhm.
many different drugs. over time. And she's like, it's, this is just a short-term thing. But of course, because we were working with her and her body got healthier, it didn't actually come back. And that was the
Right.
amazing, aspect of that story, and why she, has been such a huge advocate for people to understand the importance of nutrition.
And the drugs, I mean, even worst case scenario, the drugs work better. They need less medications, right? So they can get
Right.
more duration out of them, right?
Right.
I guess that herb is a not SP herb, but there's a Mucuna purines that is a herb that is a dopamine precursor that is also in a lot of the other products that are dopamine regulators. So just something else to consider.
Yep.
You know,
Yep. Keep going.
pull it
I'm
up.
pulling
Yep,
something up. Well, no, you keep
yep.
going, man. You're rocking and rolling. I want to bring in one last little piece here.
Right.
That's
So, I mean,
important.
we regulate the way those function. I mean, one of the most profound things I did with this Parkinson's patient, the person with Parkinson's that came in, he couldn't eat, with a spoon, couldn't eat soup or any of that stuff because of all the shakes he had. First thing he came up was, zinc deficiency, big old sugar handling problems. I'm like, what's the sugar? Where's the sugar come from? Well, he had a candy dish on his desk at the office, and
Oh,
he was nibbling on that all day. I got him off of that. We did some, zinc and some other supplements like that to facilitate um, dopamine production in him. And then we had hit a plateau. He was probably 90% better. I sent him to a neurologist friend and said, hey, what can we do to get this last 10% of this? And the guy's like, I couldn't have been Parkinson's. Nobody gets that well. You
always a
know?
misdiagnosis. Yeah,
Right.
that was somebody. Yeah, that's exactly what happened.
Love that statement, and that's
Hmm.
that's when
So
that's
that
when
was
we
just
puff up our
sugar.
shoulder. Yeah.
Well,
Mhm.
and let's look at the association that we were looking at in that research and vascular dementia, right?
Mhm.
Vascular dementia being a big piece. I really wish that this research would have included some level of understanding of the sugar intake of the individual
Mhm.
study. I think that
Right.
that would definitely bring a lot more clarity as to how much that's impacting it, for
Right.
sure.
So what was their A1C, right? We'd want to
Right.
see how their A1C was because my new analogy for A1C is like peanut butter brittle in the arteries, right? It's that
Mm-hmm.
heated sugar, right? That
Mm-hmm.
makes your arteries function like a piece of peanut brittle instead of a nice, pliable muscle ultimately.
Peanut brittle.
Don't put peanut brittle in your arteries.
Right. Yeah, I think it was Dr. Irby, actually, Virginia Irby, who was our first guest ever on,
Uh-huh.
who, when I had her at a seminar, she got up and she talked about rock candy, right? She said, look, remember rock candy? Do you remember how sharp that stuff is? She goes, that's what's sticking to your red blood cells when you have a
Mhm.
high A1C. And I always thought that was a great way to think about it too. I mean, these are like
Exactly.
razor blades running through your veins. And of course, there's going to be some increase in vascular damage, right? When you have
Hmm. Hmm.
that.
Hmm.
Yeah.
Yeah,
So,
perfect.
and the job site, what else do we need for the substantia nigra? What else? What else are most people missing that could be helpful to
Yeah,
that
I
that's
mean
wrong?
it's the regulation, like get the blood flow to it.
Hmm.
Yeah, adjusting upper cervicals, getting them mechanically functioning properly is going to de-stress the way it works. Balance, it gets feedback from the cerebellum.
Hmm.
So all of those are balancing. It's that overall. It comes back to the same theme we've had for 40 podcasts now. It's quality of life. It's all the little choices we make that you know affect us. And that's, again, part of why the book was called Headache Advantage, because the location of the head pain usually tells the priority. But same paradigm. If you've got shakes, look at what makes them worse. Learn from it. It's likely, okay, you go eat dessert, splurge for Thanksgiving and eat the whole pumpkin pie yourself, and your shakes
Hmm.
are worse. There's your input. There's the mirror and the magnifying glass on the mirror saying this is what you're doing that's really making it worse. So I mean, the shakes are going to be an indicator, and they'll get better and worse based on stress levels, based on, blood sugar stability, what you're doing to your body. So take advantage of what the body's trying to tell, so that you can minimize and reverse what's going on.
Mm, definitely.
Hmm.
I want to also point out, this is not something that I don't know if we've talked about this much, but the dry weight of the substantia nigra itself. Uh,
Hmm.
a significant proportion of that is iodine, right? And iodine is one
Okay.
of the pieces that I don't think has been given enough attention when it comes to the function of that part of the brain and the ability to be able to produce dopamine there and rebuilding it. So,
Yeah, and I mean that brings up the point of, I mean, if we're talking iodine, we got to talk thyroid, and
right.
thyroid. I always think of, I call it the penium. It's the processor for
Mm.
vocalization, for being witty. I say, oh, you're gonna have better dad jokes now. Your thyroid's working better.
Is that possible?
But I mean, just to make the point of the wittiness, the ability to think on your feet and pull that stuff up. When the thyroid's, I've had a few patients when their thyroid got really out of whack that they could barely pull the words up, barely, the family gets all freaked out because that's pretty nerve-wracking. But
Mm,
that just
mm,
goes along with that whole play between the thyroid and the substantia nigra, and the
mhm.
iodine, right? So
Yep,
look at a
yep.
good source of iodine. Eat kelp, right?
There you go. Absolutely. Yeah. Things from the ocean, sardines, all that. We've done
Yeah.
that. I
Don't
couldn't
don't
let an
hang out
episode
at
go
a
by without
nuclear
saying
plant.
sardines. What's that?
Yeah, don't hang out at a nuclear plant.
Right.
But
Right.
then radioactive iodine, right? A lot of these imaging tests, if somebody's getting, scanned for cancers, and that's they give radioactive iodine to look for the uptake of that to see where the body's fighting stuff, looking for hot spots for cancer.
Mm,
So that's another source of compromise in the iodine, where we need to then saturate the body with good quality iodine to get the radioactive junk out.
mm. So not to say that, we're only talking about dopamine when it comes to these diseases, but we're
Sure.
talking one aspect of it, just to remind everybody, right? This isn't
Yeah.
exhaustive over all the causes of dementia. But okay, so we talked about the production site, the production of it, but then let's talk about the receptors, right? The dopamine receptor.
Mm-hmm.
That was another piece that you said is not being talked about enough. So I think this is a great opportunity to help kind of bring some light to that. So what do you mean
Yeah.
by that?
Yeah. Mostly it's going to be the zinc and the B6, mineral and the iodine, right? Those are the things, those are carriers to take things, take nutrients across, if you will, open up the receptors there to work functions. A lot of those are mineral based,
Hmm,
much like enzymes. The enzyme production in the body to metabolize foods is very minerally dependent as well. So we get toxic metals that compromise, like that radioactive iodine. Those are
hmm,
going to compromise the way that the receptors are going to work. We saturate it with the good healthy minerals so the channels can open to get the nutrients across, right? And so again, B6 is a biggie, and then zinc, and potentially iodine I would look at.
But it's interesting that you pointed out L5 is one of the pain points, right? Not to say that that's going to be associated with every person, but what about the adrenal dopamine connection, right? What do you have in that thought process, right?
Yeah, well, dopamine's going to go up when we're stressed to go, right? That's
Hmm.
helped us. So the sign of elevated too much dopamine is nightmares, right? So we've
Mm,
got Parkinson's when dopamine's low, and then we've got schizophrenia pathologically when dopamine's too high.
right.
Short of schizophrenia is vivid dreams, nightmares, that kind of stuff. So
Hmm.
if a person's on these drugs, I just had one last week. It was their first visit with me, and I'm like, what we're doing is going to reduce the amount of medication you need. And they're like, how are we going to know? I'm like, when you have those vivid dreams and night terrors, then you're over medicated on your Parkinson's medications. So that would be your sign to potentially consider reducing it. So that's the schizophrenia that would go along with the high dopamine paradigm. And I lost my train of thought. Where was
No, I
I
mean,
going
when
with
we
all
talk about
that?
schizophrenia, though, the research, as I go through in my mental health seminar, is profound on vitamin B6 deficiencies and
Hmm.
and schizophrenia and the inability for your body to be able to make that conversion of dopamine into norepinephrine. So
Hmm.
I don't think we would make a mistake by adding in more B6 to any of these cases. We're
Right.
examining first their diet to see if it's there. But I would
Yeah.
also like to point out that, according to the Dr. Walsh's research and all of that, that there is a percentage of the population that's low in copper, right? Now, this gets a little
Hmm.
challenging
Hmm.
because we often tend to think of people being too high in copper, but there are people who aren't getting enough copper. And if you don't have enough copper, then you also cannot convert the dopamine into norepinephrine.
Right. Or
And
make cortisol. Hmm.
right, and the people who don't have enough copper now, I think if we're going to think about this, are more tending to be the carnivores, correct? Because you're going to get more zinc from the meats and not as much copper. And whereas in vegetarians and vegans, you have the opposite problem. You're going to get more copper and not enough zinc. So
Hmm.
I was talking to a doctor that I love and respect very much, and she's, all about carnivore, carnivore, carnivore. And I just wanted to, let her know long term, you're going to start to see things possibly go out of range with that. And so you have to be aware if you're doing that carnivore diet long term that you may want to be aware of your copper intake overall. Make sure you're balanced.
Balance. Yeah, 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 yeah.
My favorite
So
copper supplement from Standard Process is Trace Minerals B12. Another reason I love that General Health Pack because I like to get just that small amount in every day. It's a 9-to-1 ratio of zinc to copper. So it's
mhm.
actually ideal, I think, for those individuals who need to make sure they're bringing balance there.
And zinc complex has a little copper in there too, right?
Yep, a little bit.
Another. Mhm.
Very little actually. So yeah, if I did a deep analysis on all the ratios,
Okay.
Neuroplex is like a 59-to-1 zinc to copper ratio. So
Mm,
really high in zinc. The highest ratio for copper is going to be in trace minerals B12 by far,
okay.
what I
Yeah,
can
yeah.
see so far. I mean, because most people
S-
think that they just need more zinc. And I always tell people, when we have an excess of things, if you're feeling an excess of one thing, it's probably because you're low on the other. But we people very clearly go way in on zinc, which they need to. But if they don't do the balancing minerals, iron and copper, they're going to get another problem. So again,
mhm.
that's what the whole food philosophy is always what we're talking about.
For sure. So to circle back where I started to go with the whole cortisol and dopamine um, questioning that you opened up, dopamine is the precursor to estrogen, especially to hormones, right? And
Mm-hmm.
so, I mean, I've literally, so there's, for the muscle testers, low dopamine is on the chin, and high dopamine, I would actually use a positive finger, is on the top of just between the nose and
Right.
the lip.
Dopamine, so closely related to the lips right there, right? Above and
Right,
below the lip.
huh? Little kiss, huh?
It's a good way to remember it, right?
Right. And
Yeah.
so, I mean, it's so closely related to estrogen metabolism that high
Yeah.
dopamine basically would infer that there's high estrogen. Low dopamine
Yes.
would infer low estrogen. So then
Right.
we've got all the liver stuff that we've talked about previously as well. So that is very relevant. So going back to the L5, switching from there, if it's hormone related, in other words, if it's a hormone problem that's causing this dopamine metabolism, so I prioritize, is it the hormones, is it the ovaries, or testes that are causing the dopamine issue, or is it a brain concern that we need to fix the brain to correct the ovary or testes, right?
Hmm.
So we got that. If it's hormone related, that's going to be more of an L3, right in the center of the low back. L3 will tend to go out with hormone issues. C3 tends to go out with hormone issues. So for the chiropractors, they're looking, subluxation based diagnosis, that would be kind of a way to get backwards, circle back up into this dopamine paradigm.
Wow. And so let's talk about high and low dopamine real quick, because low dopamine is one that I actually find more often currently, or over
Hmm.
the past few years, I would say. And I find wheat germ oil is actually my top fix for that. It's the number
Wow.
one thing that people seem to be missing. And I think people are abundantly missing those sex hormone precursors for their body to be
Hmm.
able to do
Hmm.
not just the sex hormones, but also things like dopamine, right? All of that, like you said, that could be low estrogen. And I think we've talked about this an awful lot. I honestly, I'm going to say something crazy and bold, but I think most of the hormone replacement therapy would never have become an issue if people had ample amounts of omega-3, or I'm sorry, wheat germ oils in their diet, or these types of sex hormone precursors for the decades up until when they need it.
Hmm.
And
Hmm.
when I said that to somebody this morning in my office, she said, "Well, 100 years ago, nobody needed all this hormone replacement therapy." And I said, "Aha, exactly. 100 years ago, the wheat germ was still in the bread, right?" So for me, I that's what if I'm finding low dopamine, that's one of the first things I'm going to think of. What are some others that you're going to suggest for low dopamine that people? I mean, obviously, tyrosine could be a piece, right? It could be
Right.
the precursor, but
Yeah, well, I wanted to kind of dovetail on that. 100 years ago, they didn't need hormone. We can question whether they need it today still, right?
right, yeah, exactly, yeah, yeah. They
Fix
didn't
the
have the
body.
marketing
Nobody,
100
right?
years ago for it.
They
Right,
didn't have trillions of dollars behind it, right?
right, right.
And yeah, granted, okay, girls feel better when they get a little estrogen or get their hormones in there, but
Hmm.
it's not fixing the problem. It's creating other problems down later on. I mean,
Right.
that's fixed the way the body functions with things like wheat germ oil, with get your adrenals. Ultimately, most of what's happening there is adrenals are fatigued, so they don't have the adrenal reserves to pick up the slack as hormones, as the ovaries and stuff start retiring and shutting down, and then they have problems and they get hormones and they feel better until they have breast cancer and
Mm,
that sort
mm.
of stuff. So, I mean, I couldn't let that one rest on the, 100 years ago.
No, man. Totally, totally. I'm with you. I just realized the time, man. We've only got a few minutes left, and we haven't even talked about pain yet. Like, what can people do for pain?
Right,
We talked a little bit about location of the pain, and you said L5 is
right,
really common for that. Is there anything else that jumps to your mind? And if you're watching and you got a specific spot for pain and you need it, leave it in the comments, and we'll
right.
definitely get to it, address
Yeah.
it. What are some other?
So glute medius, so when the hip wears out, often that's the glute medius has been weak. That muscle gets weak when the ovaries or the testes are not functioning properly. So, I mean, that's going to be that, chiropractic wise, they call it Trendelenburg, where the hips kind of laterally shift.
Hmm.
I don't know if you could see that they kind of
Yeah, can you do your Elvis
walk like
effect?
that.
Thank you very much.
So that's
Even after that huge race you did this weekend, you can still do that, right? Yeah.
I can still still shake it, huh? So that's that weakness in the glute medius, and when that muscle's been weak long term, year after year, then that hip joint tends to wear out because it leaves it very weak and vulnerable. I mean, why would one hip wear out and the other one doesn't?
Mm,
Rocket
mm,
science, isn't it? I mean,
right.
they took the same amount of steps on both hips. Why would one wear out and the other one didn't? Because those muscles aren't working properly, so that joint got the wear and tear osteoarthritis. So hip pain, especially just below the belt line along there, that muscle is glute medius. That's going to be a sign that there's a hormonal imbalance that you want to look, potentially at hormones or upstream for dopamine metabolism.
Mm,
Um, Overall pain to kind of wrap it up from a general, I mean, a lot of people want to look at chase inflammation, that sort of stuff. What's driving the inflammation? Is there an infection in a gland or
mm,
organ that's, perpetuating that? Where is the dysfunction? The location of the pain tells everything. But
right.
generalized, I always talk about enzymes, proteolytic enzymes, protein digesting enzymes away from food are your natural anti-inflammatory. They work phenomenal if you just had a surgery. So, I mean,
Mm.
when my wife had her ruptured Achilles, we had her taking a couple Enzicor every hour. She needed no pain meds, none of these. So, phew, I don't have to worry about having Parkinson's, right?
Right. Yeah. Wow.
But I mean,
Okay.
it's that profound. It cuts it. There's all kinds of research that literally shows that the healing time is less than half. The recovery is radically accelerated by taking these enzymes hourly away from food. Away from food, they digest the protein of the inflammation. With food, they just digest your food better. So that's
You
kind
were
of the 10-second summary
you
there.
were using Enzacor for her two every hour for how long? How long was she on the
So
protocol?
typically, it's the first 2 weeks post injury.
Okay.
Statistically, if you do like three the day before, if you know you're going to get an injury, the only time you really know that is if you're going in for surgery. But you take them before, and then you start taking them hourly for the first 2 weeks, and then right about 2 weeks, sometimes they'll get kind of that epigastric pain right at the bottom of the sternum area. That means that they're taking a little bit too much enzyme and start backing it down sequentially from there over the next couple of weeks potentially.
Beautiful pearl right at the end for everybody. And
Whew.
that's time, everybody, unfortunately. But here's the lesson. I think the takeaway is if you are taking those opioids or if you had to do that, still really be clear about where you were feeling the pain so that you can use that information to heal what's really behind driving all of those problems, whether it's L5 in the adrenals or it's, the hips and hormones or the gluteus, all of that. Take note of it, learn from it. And if you don't know where to go next, come here next and tell us where and we'll talk about it.
Ooh, that's it.
Awesome. Thanks, Dr. V, for another great episode. Thank you all
Oh,
for
so fun.
listening, and we will see you in the next one.